practical for oral contraceptive. Okay, so we'll start our class now. So the first one I will show you all is about, okay, this is oral contraceptive pill. You all know that this pill need to be taken for 28 days and must follow the order of days where you need to take the pill to prevent pregnancy. Okay, this is an oral contraceptive pill. We should come out in your hospital, okay, when you go for exam. So this is the first. Number two, I would like to talk about practical. So what you need to do in the practical is you need to write a report on contraceptive pill based on the above heading. First is introduction. What is a contraceptive pill? Number two, do a literature review on contraceptive pill. Number three, write down about material available in the market. Number four, we talk about method to use the contraceptive pill. How do you use it? Then also number five, you discuss about emergency contraception with emphasis on the uses, benefit, and side effect. And number six, discuss about alternative contraception with emphasis on the use, benefit, and side effect, conclusion, and reference. So this is a practical that you need to do. We cannot do practical, so we'll do what we say practical based on a thesis writing. Okay. So today I will discuss about literature available for emergency contraception. Okay. Before I start, is there anything that you want to ask me regarding this practical? If no, we can start about the topic on emergency contraception. Akil, anything you want to ask? Just make sure that you're finished in 1 week's time.
No, I think no, not yet.
Okay. Fine. I stop. You all have this practical, correct? I sent you all before, correct? Okay now. So I stop. There we go. We talk about emergency contraception. Okay. So we first talk about emergency contraception. There are safe methods to prevent pregnancy after unprotected sex. This can happen to anyone, so let the client tell her story now if she wishes. Offer support without judging the client. Client may want to consider emergency contraceptive if no method was used. A method was used incorrectly, for example, missed pill or late for injection. Method failed, for example, broken condom or expelled intrauterine device. If she can answer yes to any of the question appendix 1, she is probably not fertile and will not need emergency contraceptive. However, if she is worried, she can still use emergency contraceptive. How long ago do you have unprotected sex? You need to ask the client. Up to 5 days ago, then the emergency contraceptive pill will be good. She should take the pill as soon as possible after unprotected intercourse. They can be taken up to 5 days after sex. Or emergency copper IUD, intrauterine device, which is more effective than pill, but those at high risk for STI, sexually transmitted infection, should not use it. Can also be used up to 5 days after unprotected intercourse. A good choice for women who want to keep using an IUD. If more than 5 days ago, the most probable one will be counsel. Then another question you need to ask is that could you have been exposed to STI, sexually transmitted infection, or here we call it as sexually transmitted disease or HIV. If she had unprotected intercourse where circumstances suggest HIV or STD transmission, offer and start post-exposure prophylaxis for HIV immediately, or presumptive STI treatment if available, or refer for further counseling, support, and treatment. Okay, then you need to ask, does client want to use emergency contraception? For emergency contraceptive pill, we'll go to the next page. For emergency copper IUD intrauterine device, we'll discuss about it later. Okay, emergency contraceptive pill is need to be taken as soon as possible after unprotected sex. This does not cause abortion, might cause nausea, vomiting, spotting, or bleeding. Do not prevent pregnancy the next time you have sex and not for regular use. So need to be taken as soon as possible. So she should take pills as soon as possible after unprotected intercourse, ideally take within 72 hours, taken up to 120 hours after, but become less effective with each day that passes. If she had other act of unprotected sex since the last menstrual period, she may already be pregnant and an emergency contraceptive pill would then not work. If she takes emergency contraceptive pill and already pregnant, they do not harm pregnancy. She should return if next menstrual period is more than 1 week late. So what is the type of emergency contraceptive pill? There are levonorgestrel only emergency contraceptive pill. Work better and cause less nausea and vomiting than combined emergency contraceptive pill. Dosage is 1.5 milligram of levonorgestrel in a single dose. Number 2, there's a combined estrogen progesterone ECP. Used if levonorgestrel only pills are available. Dosage is to take 2 doses of 100 microgram of ethinyl estradiol plus 0.5 milligram of levonorgestrel, which should be 12 hours apart. It does not cause abortion. ECP prevent pregnancy. They do not cause abortion. They work mainly by stopping ovulation. However, it might cause nausea, vomiting, spotting, or bleeding. If she is taking combined estrogen progesterone pill, she can take anti-nausea medicine like meclizine hydrochloride to prevent nausea. If she vomits within 2 hours after taking emergency contraceptive pill, she should return for another dose as soon as possible. She may have spotting or bleeding a few days after taking pills. Do not prevent pregnancy the next time you have sex and not for regular use. So in emergency, the patient, the SE do not protect against future sexual intercourse and less effective than most regular methods. Okay, and need continuing protection. Please consider, could unprotected intercourse happen again? Do you need dual protection from pregnancy and STD, HIV, or AIDS? Can you always choose when you have sex? Do you have a regular method? Are you satisfied with it? The best way to avoid pregnancy is abstinence. Okay. And then need continuing protection. Could unprotected intercourse happen again? If yes, invite client to tell her story. If story suggests STD exposure, refer for treatment. Discuss condom if appropriate. Do you need dual protection from pregnancy and STD, HIV, or AIDS? If at risk for STD, discuss dual protection from pregnancy and from STD, HIV, or AIDS. Go to dual protection tab. Can you always choose when you have sex? You need to talk whether the story suggests coercion or violence. If yes means sexual abuse can occur, we will refer for more help if possible. Do you have a regular method and are you satisfied with it? Can start another method straight away, including pills. If you choose no regular method now, offer ECP and condom with instruction for use. Another method that you can use is an emergency copper IUD. IUD is an intrauterine device. Can use if you have unprotected sex in the last 5 days. Doctor, nurse, or midwife place IUD in womb and can cause some cramp. IUD can be taken out later or left in place for continuing contraception. So emergency copper IUD can use if you have unprotected sex in the last 5 days. Very effective. It's more effective than emergency contraceptive pill. If you can estimate the time of her ovulation, she can also have the IUD inserted more than 5 days after unprotected sex, as long as it's not inserted more than 5 days after ovulation. There has been no research on the mechanism of action IUD used for emergency contraception. The research is not available, but it's been proven to be effective. Doctor, nurse, or midwife can place IUD in womb, but this can cause some cramp. IUD can be taken out later or left in place for continuing contraception. Can use as long-term contraceptive method if she is medically eligible or can be removed at any time. If kept in place, IUD keep working up to 10 years. If emergency IUD does not prevent pregnancy, the IUD will need to be taken out. If you choose emergency copper IUD, go to copper IUD tab to check medical eligibility for IUD. So they have a certain criteria which include and exclude patients from using copper IUD. And also there will be information on IUD insertion. So what is a copper IUD? It's a small device that fits inside the womb. It's very effective. It keeps working up to 10 years depending on type. You can remove it for you whenever you want. It's very safe. Might increase menstrual bleeding or cramp. However, there's no protection against STD or HIV or AIDS. Okay, then you need to ask the patient whether they want to know more about IUD or talk about a different method. Okay, so this is a emergency contraceptive. So emergency contraceptive is for those who have had sex and are wanted to prevent pregnancy within 5 days of sexual activity. Okay, this is suitable for client which is a rape victim or sexually abused children. Okay, and also for those who disagree with their pregnancy. However, if there's any sexual abuse, the case needs to be reported to the higher authority. Okay. Okay, so this is the practical that you need to do. Anything that you want to ask me about? So?
Doctor,
Yes.
can you open back the practical, the question?
Okay. 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 Yes.
Okay, so regarding the discussion for this question number 5 and 6, should we discuss it in detail or just like a summary?
Make it in a summary.
Summary, but emphasize on the user's benefit and side effects.
Yes. You
Okay.
can other articles to find. I'm sorry that we cannot do a practical. Ideally, as we cannot do practical, we can only do a counseling. The question is similar to counseling.
So how should we do the literature review, Doctor? So shall we just...
The literature review is that you need to find a few journals which are about contraceptive field.
Okay, and then make a summary of the journal.
Yes, make summary of the journal. Means that you find a few journals which talk about contraceptive field. Example, when is contraceptive field made? What is the year? And everything.
Okay, Doctor. So the material available in the market is just the types of contraceptives that are available in the market.
Yes.
Okay, Doctor. Okay.
Then, so the conclusion means from the what you need to do is that you need to introduce what is contraceptive pill, what is the composition of contraceptive pill, and why do you need a contraceptive pill. After literature review, you just go to Scholar or go to Google Scholar, and then you can get a few literature. Just get from the what we say from the articles available. The articles available, then you can complete the lecture. Then if material available, I have given in the first lecture what is the material available in the market and what is the other brand new.
So the about the literature review, should we attach the whole journal and then?
No, you just take the abstract only. Then
abstract only.
Yes. Then after that, what you do is that you quote the literature and put it in the reference.
Reference. So take the abstract of the literature, the journal, and then put it like that, or should we
you just
change
the normal format, Herbert format. Herbert literature review. Herbert HARBARD. You just put there. Okay. Example: Tan ETAL 1996.
Yes. Okay. Okay, I understand. And the last question, about the alternative contraception. Is it regarding about the permanent one? The alternative?
Alternative contraception, one is oral contraceptive pill. Other than that, alternative contraception, there's a few. One is abstinence, number 2, withdrawal, condom, and also what is IUD. These are the few of the famous methods.
Okay.
Means that we talk about other method of contraception as well.
Okay.
Okay. Anything else? What about
Doctor, is there how many words do you want or how many pages?
Okay, I would suggest to make it short. Every topic you make it one page if possible. Okay. So introduction one page, introduction maybe half, but the maximum also around one page for each.
Okay, doctor.
Can that should be simple. 1 to 2 lah to be, because somebody they use a bigger font. Font should be Arial, font 12. So at least 1 to 2 page maximum, but preferably everything in one page. So total will be 8 page.
Can we use Times New Roman?
Can Arial or Times New Roman? Same.
Okay, doctor. Okay, doctor.
Okay. Anything else?
When is the submission date, doctor?
Submission date can be next week.
Next week on Friday?
Yes, on Friday.
Okay, thank you.
Okay, and another thing I want to ask you all is that tomorrow we will have PBL. So the group will have PBL with me. What time do you all want your PBL?
9 as usual.
9. Can we make it 9:20?
Oh, can doctor. 9:20 can.
9:30. 9:30. And
9:30 can. Okay, can doctor.
Okay, sure. So you all prepare this practical. We meet for PBL tomorrow. Thank you.
Okay, doctor.
Thank you, doctor.
Thank you, doctor.
Okay.
Doctor.
Thank you, doctor.